Pharmaceutical giant Moderna is investing in a shared service facility here in the country. Joining us now is Moderna Senior Vice President and General Manager Patrick Bergstedt. He is based in the US, but he joins us now in our CNN Philippines studios in Manila. Patrick, great to have you with us.
Good evening, Rico. Thank you very much for the opportunity to join you on your program.
All right. We have just been reporting the cases in the Philippines have been on the rise. Now it's 25 to 30%. How vigilant should Filipinos still be as we see the pandemic still around us?
Rico, people should remain vigilant. I'm reassured when I come to the Philippines. I've been in a number of meetings in Manila, seeing people wearing masks, being considerate of their fellow citizen, but also thinking about themselves and how to protect themselves. As we think about the fact that the global emergency may have been lifted by the WHO, the fact that the virus continues to circulate, and the fact that the virus has changed, it's not the same virus that caused the pandemic 2 years ago, but people need to consider their vaccine status, discuss with their physician, particularly if they are at risk with underlying disease. The fact that the WHO has made their declaration is actually proof of the contribution that vaccines have played to help restore some sort of normality to society.
Moderna is one of the major vaccines that have been used by many Filipinos across the country. Patrick, and of course, would you advise them, for those who are still hesitant to get the primary doses, then after that, the boosters, and then the bivalent vaccines?
Absolutely. The data is overwhelming. Those people who are vaccinated, there's less chance of hospitalization, less chance of underlying disease, and less chance of death. The data is very clear.
And what is the future, Patrick, of the mRNA, which is the heart and soul of the COVID-19 vaccine going forward?
So firstly, let's think about what is mRNA. mRNA is an informational molecule. As you and I sit here today, we have natural mRNA that's helping to protect us or from diseases. The Moderna vaccine, what it does is it actually gives you the code for your cells to make proteins to fight infection or to prevent disease. So if one can understand that and think through that, the permutations and the possibilities for the future are endless. We now have data showing that mRNA we can use for vaccines, also for oncology. We're continuing to study mRNA in rare diseases, as well as those latent viruses, those viruses which are dormant and they flare up at certain times, for example, cytomegalovirus. So we are very excited, and we are actually very interested in being in the Philippines to actually expand the science of mRNA here in the Philippines.
Indeed. You met up with President Bongbong Marcos in Washington, D.C. during his recent trip. And Moderna will be setting up a shared service facility here in the country, not next year, but very, very soon, just right around the corner. Tell us, Patrick, why is the Philippines a perfect location for the third shared service facility of Moderna?
Should I say, Rico, it's because you've got a number of beautiful islands, including Luzon.
7,600 islands, which you have to come back all the time to visit.
So seriously, though, we went through a very diligent process. We only have 2 other shared services. One is in Poland, supporting Europe. The other one in Atlanta, Georgia, supporting the Americas. So we looked in the neighborhood, and you have a lot of competition for shared services. But because
a lot of these countries are tugging you right and left to put that shared facility in their country in Asia.
Indeed. But after a robust, rigorous process, we chose the Philippines for a number of reasons. You have a very experienced industry of providing shared services to a number of industries. There's excellent talent. There are people that have an excellent work ethic, great language skills, and so there's a very diverse workforce that we can tap into in order to create jobs, but also to provide this support to the rest of the Moderna business in the region.
define for us exactly what is a shared service facility. Because in the past, I mean, when this news came out, everyone would say, oh, Moderna will be manufacturing vaccines in the country. But it is a shared service facility.
Think of a shared service as a center where we have a number of experts, skilled in their profession, skilled in their domain, who provide expertise and solutions for a number of fields. For example, you may have finance people, you may have human resources, you may have regulatory resources. Indeed, pharmacovigilance, we study the safety of our vaccines. So there are a number of services that this center will provide here in the Philippines for the entire Asia-Pacific region. Today we have about 7 different subsidiaries around the region, and this subsidiary here in the Philippines will support that entire region.
And what's important right now, Patrick, for the country, that's why we have been seeing the president visiting more than 10 countries around the world in his first 11 months in office, is to bring investments into the country, foreign direct investments, and to create jobs for many Filipinos. On the first phase of this shared service facility of Moderna, how many jobs will be created and what kind of skills will you be looking for in Filipinos?
So we're moving very, very quickly. As you mentioned, we hope that this first phase will be complete before the end of this year. We hope that the facility will be up and running during the third quarter of 2023. This initial phase will be approximately 40 to 50 people in this center, and specific skills will include finance, regulatory services, pharmacovigilance, human resources, as well as IT.
Mm-hmm. You have also, as you mentioned, 2 other shared facilities, one in Poland and one in Atlanta, Georgia. How many people are you employing in these separate shared service facilities?
Very, very similar numbers during the first phase. So the scale-up in the Philippines is being modeled on the other centers that were established in Poland and Atlanta, Georgia. So we're following a similar model. What is very different is that this facility is dedicated to Asia Pacific.
Mm. And share with us, what can the Philippine pharmaceutical industry learn from Moderna?
I think that we can both learn together, Rico. What has impressed me is about the level of innovation that is possible here in the Philippines. Let me give you an example. At the time of when we were discussing with the Filipino government the supply of vaccines to protect the Filipino people, the private sector came together with the government to provide broad access for the Philippines. This is the only country in the world where the public sector and the private sector work together jointly with industry for the greater good of the people of the country. It's that kind of innovation that inspires me, encourages me, and thinks about the possibilities for the future.
And that is very important, especially for the Philippines, to learn about technological innovations of top pharmaceutical giants like Moderna. This initial phase of 40 to 50 people, could this eventually, Patrick, be ramped up in another phase?
Absolutely.
So there could also be an expansion of Moderna in the Philippines?
Absolutely. We see this as a number of phases, and what I've described is this initial phase.
And where do you plan to set up this shared service facility of Moderna?
We are working hard to select a facility at the moment. Part of the reason for being here over the past couple of days is to meet with a number of stakeholders, a number of authorities, visit different centers to find the best location. In addition to the shared service, we will also have a commercial office, which will include commercial people as well as medical affairs in order to improve and build upon our relationship with the government and other customers that we will be establishing business partners with.
Will this have a major impact on Moderna's overall operations?
Indeed. This is a country of 100 million people, more than 100 million people. Mm-hmm. This is a region that unfortunately has seen many pandemics. COVID is not the first pandemic that Asia Pacific has seen. Yes. We've had H1N1, we've had MERS, we've had SARS, and we've had COVID. So we, as our mission, is to advance the science of mRNA, to also work with the government on pandemic readiness, so that we are better prepared, so we can learn from this current pandemic and be better prepared for the future in order to provide health security for Filipinos through vaccination.
Well, by setting up shop here in the Philippines, Patrick, this really gives the Philippines a lot of credibility and will open the doors for more foreign investors in the country, with Moderna setting up its shared service facility in the country.
We are proud, and at the same time we are humbled to be here and to be able to continue to support the government and also to provide health security to the Filipinos through vaccination. Thank you.
Patrick Bergstedt, thank you so much for joining us on CNN Philippines, The Final Word, Moderna's Senior Vice President and General Manager. Enjoy the rest of your stay in the country.
Thanks very much, Rico. Thank you.